see. Is this a good place to stand? I can kind of. How's that? It's probably because I'm backlit, sort of. Next time I have to bring my portable light. Okay, well, so I guess I will just start. Okay, so anyway, thank you for taking a few minutes out of your busy day to chat with me. It's exciting to be getting to know you guys, although I'll be doing most of the talking. Yeah, I'm really excited to join the Marsden Center because I'm very excited about the kind of work that you guys are doing. So recently, my brother-in-law actually passed away of cancer. He was quite young, 41 years old, and he's an osteopath. He really was a firm believer in the natural, approaches to health in general, which actually probably delayed his diagnosis, but anyways. So he did do vitamin C intravenous at Dr. John Gannage's place in Markham. I don't know if you guys know about it. But I guess he didn't know about this center, and at the time I didn't either. So I'm really glad to now know, so that if this ever happens to any of my other loved ones, then I have someone to refer to who has a lot of expertise. So thank you for doing the kind of work that you do. So I just wanted to first start, because I know your time is valuable. I'm focusing first on what traditional Chinese medicine can do for cancer patients, since most of you have some background in traditional Chinese medicine anyways. So I'll call it TCM for traditional Chinese medicine. Hey, man. Sorry, they told me to start. Don't blame me. Okay, so first I'm going to do an introduction to what traditional Chinese medicine, or TCM, can do for cancer patients. And then in the second half, I'll just give more of an overview about traditional Chinese medicine and treatments and that kind of concrete thing, what treatments look like, and what patients might want to know when they book. So what can TCM do for cancer patients? So I just have a quote here. There was a qualitative study done by some researchers I know in Australia of breast cancer patients. So for this particular patient, it's pretty typical of the kind of responses they gave, that they found that traditional Chinese medicine was a big support to them throughout the process of doing their conventional treatments. In dealing with the stress, of course, of hearing the diagnosis of cancer, as well as in boosting up their immune system so they felt stronger, and in relieving side effects so that they could get through chemotherapy quickly. So I'll go through this type of thing in more detail, but before I do that, I should just mention that, like in China, traditional Chinese medicine is practiced alongside biomedicine in hospital, like in almost every hospital, I would say. And then there are certain hospitals, like the one that I was at, that focus on Chinese medicine. So in every single department, including the oncology department, they would use Chinese medicine, herbs, ear seeds, acupressure, etc., to support the patients throughout the entire process. And I went to a lot of conferences that doctors and researchers, et cetera, would meet at, people who do the biomedicine, the conventional approach, and then people who do the TCM approach. And it's really widely acknowledged that one of the strengths of Chinese medicine is supporting the body's own immune system, the body's own resistance. So in Chinese medicine terms, it would be the zhang qi, or the righteous qi, the energy that we already have that helps us naturally ward off disease or deal with the cancer cells that are in all of our bodies. So TCM is universally acknowledged to be really good for that side of things. I'll go into more detail as to what TCM is good at other than that. So traditional Chinese medicine oncology is a branch of traditional Chinese medicine. So we have TCM gynecology, TCM orthopedics, etc. So oncology is one of those fields of greater specialization. In China, it mostly focuses on herbal medicine, but there's been people who develop acupuncture specifically for cancer patients as well. So certain protocols or safety, and then looking at the research and that kind of thing. So that would be called oncology acupuncture. So here's just, these are some lecturers, a couple of the profs I studied with, and then this is a plaque at our department in the hospital saying that they cooperate with Canada. So as I mentioned, there's a ton of research going on right now in terms of what herbal medicine can do to support cancer patients. So that's being done on every level, from in vitro studies to animal studies like with mice, as well as some clinical trials and some retrospective studies, so looking at patient data. There's a lot of research right now in this area because, as I'm sure you all know, cancer is sort of a field in which we still need to make a lot of progress in understanding. So traditional Chinese medicine oncology also includes a discussion of safety as well as how to select the herbs from a TCM point of view. So this is my thesis topic. It's herb selection and safety issues for breast cancer patients using TCM along with conventional cancer therapies. So I looked at how we would choose the herbs. I can go into more detail with those of you who have a TCM background in terms of the treatment principles used, like to support the qi, the spleen, reduce phlegm, move blood stasis, etc. And I looked at how those herb selection choices would change depending on if the patient is at a different stage of breast cancer or a different molecular subtype, so luminal A, B, HER2, or triple negative breast cancer. So different types of breast cancer would also maybe merit different herbal selections. And then also looking at how we can support people through different phases of the treatment. So before surgery, after surgery, etc. I also looked at safety issues, specifically around herb safety. So what are some toxic herbs to avoid? When a patient is taking chemotherapy or other drugs, what should we be careful of when prescribing herbs, because we don't want them to reduce the effect of the herbs? So the benefits, this is a slide that has a lot of information. I kind of just summarized the main benefits. I tried to make an acronym to make it easy to remember. So 3 S's. How can TCM help patients with cancer? In 3 ways. So it can soothe the patients, strengthen them, and it can help slow cancer growth. So under soothe, basically, as I'm sure many of you know, a lot of our goal of treatment is just to reduce discomfort and improve quality of life for patients. So that would be reducing pain, numbness, swelling, addressing menopausal symptoms, let's say with endocrine therapy. It would be also dealing with the emotional effects of cancer. A lot of people, for example, have anxiety or they have difficulty sleeping, and we really focus on that because sleep is so key to the body's own recovery process. As well, there's other specific symptoms like dry mouth, difficulty swallowing, shortness of breath, etc., that have been shown to be responsive to acupuncture and/or herbal medicine. And we can also reduce the side effects and toxicities of conventional treatments like chemotherapy and radiation. By the way, if you have any questions, please interrupt me anytime. I'm speaking a little bit fast because I know time is of the essence for you. So number 2, strengthen. So as I mentioned before, one of traditional Chinese medicine's strengths is to improve the balance of the body and to improve the person's natural state. We all kind of have this homeostasis naturally in the body, and TCM can help restore that balance. So how we can do that, for example, is there's a lot of immune modulating herbs that we may include in the formulas. We can help to improve the blood counts. So there's been quite a few studies showing that herbal medicine and acupuncture can both help with cytopenia after chemotherapy or radiation. Fatigue, of course, a big issue, and related drowsiness. I forget how to pronounce this word. Cachexia, yeah. So a lot of these terms I learned in Chinese, so I'm kind of like, how do I say that English word? So yeah, when there's a lot of weight loss and wasting and the person's really fatigued, then we can also do a lot of herbs. And that's one of the, I would say that's one of the predominant ways actually that we would treat in the outpatient department, is to support people after their active therapies were over, to kind of boost them back up into a really stronger, happier, healthier state. And then slowing cancer growth. So a lot of people actually don't realize that there are survival benefits for people who use traditional Chinese medicine regularly. So there have been a number of studies in recent years, retrospective studies, a prospective cohort study that was done by a team in Beijing in conjunction with the MD Anderson Center in Texas, have all shown that there's correlations between the length of time that someone gets traditional Chinese medicine treatment and their overall survival. I mean, I think there's still obviously a lot of unknowns as to exactly what is going on and how exactly is Chinese medicine interfering, but we see that there is a result in that endpoint. So both to improve quality of life as well as to improve the length of survival, we feel confident that traditional Chinese medicine can be of benefit to anyone looking for both of those things. There is some research into how herbs and acupuncture can help with sensitization to chemotherapy and radiation. And as I mentioned, there's quite a few herbs under investigation. So aside from the kind of well-known herbs like the mushrooms and astragalus and ginseng, there's actually a whole host of herbs that are under investigation for cancer-fighting properties and have been found in animal studies or in the lab to have positive effects. So we do try to keep that research in mind when we're making modifications to our formulas, to try to include more of those. As well for precancerous conditions, so for example, for cervical dysplasia or for chronic atrophic gastritis, colon polyps, that type of thing, before they develop into cancer, then that's another time that we can intervene and try to slow the progression. So when would we use TCM? So as I mentioned, we could use it even before cancer develops. We can use it around surgery. So typically we can try to prepare the body for surgery, as well as helping with recovery through helping with circulation, wound healing, decreasing inflammation, etc. We can also assist with radiation before, during, and after. So there's not as much concern for interactions between radiation and traditional Chinese medicine as for, say, chemotherapy. So we feel pretty confident we can use it throughout the process and help with a lot of the side effects of radiation as well. So whether that's dry mouth or fatigue or whatever. Before and after chemotherapy, we can totally use that. During chemotherapy, I would say acupuncture is fine. For herbal medicine, I sort of would only use it if necessary. So let's say if someone was delaying their next cycle because their blood counts are too low or something like that, then maybe that's a time to intervene. Or if they're having a lot of other discomforts that we might be able to help with. Otherwise, I would sort of err on the safe side in terms of herbs, just because the person is taking such a strong drug with the potential for toxicity. So I'm a little bit more cautious than some people. Like in the ward in China, they just use it all the time, like completely throughout. Okay, so during endocrine and targeted therapies, we can also use it, but of course, we also want to be careful to not interfere with the drugs. So let's say with endocrine therapy, there's been a fair amount of research into herbs that may have like an estrogen-like property, like dongui, Angelica sinensis. There's like quite a lot of research into that. When would you use it? When would you not? When would you be careful? And what to combine it with to make sure that it's not counteracting the endocrine therapy, the hormone therapy. Then, of course, as I mentioned, like after the patients are done with their, let's say they got a diagnosis and they go through the surgery and chemotherapy, whatever it is, and then they're kind of done with the active treatment, a lot of people don't know what to do at that point. And the biomedical system's kind of like, okay, you're done. So we help a lot of people in that stage. As I mentioned, to kind of just boost back up the body, assist with recovery, and then to reduce the chances of recurrence and metastasis. And then, of course, there are some patients who might not be in conventional treatment at all, either of their own choice or because they're not eligible, or perhaps they're for age reasons or for other reasons, they are not choosing to go the conventional route. Then we also work with them, and we use some herbs that have stronger, like, cancer-fighting properties. So perhaps that might be like the insect herbs. Yeah, so some herbs are insects. I'll talk a little bit more about that after. Quality of life, as I mentioned, and survival. So we can help people at any point for those reasons. So I don't expect you to read all this, but I just wanted you to know that I didn't just make all this stuff up. So there's a ton of research out there. This is just a sampling, and I'm happy to share more. Okay, so as some of you already know what TCM is, but just to give a quick recap, so it's based on a number of medical theories. So actually, there's a diverse there's probably hundreds, if not thousands, of traditions, medical traditions in what is now known as China, as well as Japan and Korea, which have very related medical systems. So the diversity within these traditional East Asian systems is immense. But what happened is they tried to collect some main themes into what is now called traditional Chinese medicine, and make it easier to teach in universities in a standardized way. So usually we talk about the meridians in the body, as you've all seen those little models that have the lines on them, and those are related to what I would call functional systems in the body. So we talk about traditional Chinese medicine, liver or heart or kidney. We don't really mean the organs in the body. We just mean that system. So I think a lot of people get confused about that. But basically that system corresponds to one of the 5 elements that we try to balance. So Chinese medicine is all about bringing the body back into balance with nature. And we talk about the elements of water, wood, fire, earth, and metal, and what they kind of do within the body. It's sort of like abstract, but I can go more into detail about what it means practically when we have more time, which is probably not now. It's all about balance, and it's all about harmony with nature. So just so you know, it's really old. These are some of the seminal figures in Chinese medicine, some of the first. So that's the Yellow Emperor. This is Zhang Zhongjing, a major herbalist who we still use a lot of the formulas from. This is an acupuncturist. And then this is sort of the divine farmer who is accredited with coming up with the first list of herbs. So Chinese medicine actually has probably one of the most extensive list of medicinal herbs that we use in our formulas, like in the world probably, as a system. So I'm pretty passionate about herbs, so yeah, forgive me. But there's tons of herbs that we use, probably 300 plus herbs that we use typically, and they usually get combined in formulas of about like 4 to 20 herbs. So just so you know, so Chinese medicine is not just this woo-woo, weird, superstitious thing that is from days gone by, but it has continued to modernize and develop as medicine has developed. So right now, these are just pictures from the hospital that I was at. This is the oncology outpatient ward. We also had inpatient. We had 3. Anyway, this is the herbal pharmacy. So as you see, people are lining up and they're getting the herbs dispensed to them by professional TCM pharmacists. This is one of the things we do in the treatment. We take a pulse reading on both hands, and the hospital has all kinds of departments, as I mentioned, including emergency. So some hospitals even use traditional Chinese medicine in the emergency department. In terms of schooling, so it's also, here we just have these small little colleges, but there they have whole universities dedicated to Chinese medicine. So this is the university that I did my master's thesis at. It has thousands of students, and they have many different departments that you can specialize in. So there are people who actually specialize in nursing from a Chinese medicine point of view. There are people who specialize in the herbs, and they do research into the properties of the herbs. And there's people who do research into the literature and history to relate the old classics to how we treat people today. And you can specialize in acupuncture or tuina massage, and I specialized in internal medicine. Okay, so then just a couple of key points about Chinese medicine to know is I made another acronym. It's called ABC. So the Chinese medicine point of view is both alternative. So I think one of the benefits for patients is that it gives them another view. So a lot of people I work with, they're really excited to find out that there's a completely other way to look at their body, and actually their body and mind, and how they're interacting and how they can maintain and restore health. So it's its own system that's very unique. As I mentioned, it's all about restoring balance, so that's the B. And then C is customize. So we completely customize every treatment to that exact patient. We don't say, oh, you have breast cancer, so I'm going to give you all the same acupuncture points and all the same herbs. It's different every time. The 5 branches, as most of you know, are acupuncture, herbs, tuina, dietary therapy, and energetics or qigong. This is one of my favorite acupuncture comics. So as you can see, there are some cave people throwing spears at this mammoth. And although the spears land here, the mammoth suddenly feels like their neck pain is gone. Obviously, this probably didn't happen. But the principle is that we can use one part of the body to treat a totally different part of the body. We can use the outside of the body to treat the inside. We can use the feet to treat the head, et cetera, et cetera. So we basically work on those meridians that are in the next slide. So this is a traditional bronze acupuncture model that I'm holding the hand of. And you can actually practice needling this guy. But basically the idea is that if you needle one area, it affects that whole meridian. It affects that whole line. Right now, if you were to translate it into modern medicine, it might be something like fascia, like that the different parts of the body are connected in some way. And just to point out, there's like a lot of different types of acupuncture. So there's TCM theory and acupuncture, and then there's like other classical acupuncture theories. Japanese acupuncture trigger point, and I have training in most of these as well. So usually I will use a mix when I see patients. That means that what that means for the patient is that they may get different approaches from one time to another, and they also might get acupuncture in unexpected places. So let's say they have neck pain, then maybe I will needle their hand or their foot. So just something to keep in mind if people are confused. So as I mentioned, I'm very passionate about herbs, and this is the person in the middle is Tu Youyou. Does anyone know who Tu Youyou is? So Tu Youyou won the Nobel Prize in 2015, Nobel Prize in Medicine or Physiology, for her development, her and her team's development of a malaria-fighting drug, which was taken from the Chinese medicine list of herbs that we use for malaria. So what the researchers did was say, okay, well, what is traditionally used to treat malaria, and can we create some kind of extract of that we can then use? And this is like a very widely used drug now. Now, what a lot of people don't know is that to develop the drug, she actually went back to the old classics, and she looked at how did they prepare this drug, because they kept trying and they didn't succeed. But she went back and found that it needed to be a cold preparation, and that's how the medicinal properties got extracted properly. So by doing this kind of research that kind of bridged the old knowledge with new processes, she was able to develop this drug that then won the Nobel Prize. So that was kind of the talk of the town when I first arrived in Nanjing. Everyone was like, I don't know about fries. But so that's not how we typically use herbs as herbalists. We use the whole plant. But we feel that the different components in the plant actually work synergistically. So they support each other or they mitigate the side effects. So we have a kind of balanced approach by using the whole plant as well as the plant in combination with other plants. Again, this is a picture of a pharmacy. It's just one aisle. It's very huge in the hospital. And then there are different forms of herbs. So you can see here, we often do a liquid form. It's kind of, the lighting isn't very good, but liquid form, and then we often have the herbs just dried, and we'll mix them into packets that then get boiled up, or they may get ground and then mixed into a pill. And then often people will get the herbs in like a little packet like that. A lot of the herbs are plants, so we can grow them, and some of them get used raw. And then they can be used for all kinds of internal medicine issues. So as I mentioned, the formulas, just so you know, they're usually a complex of different herbs, and they're customized to the person. So we might use a formula as a base and then modify it. And then each herb in that formula has a specific role. There are a lot of classical recipes that we use, and the approximate cost in Canada, depending on the form of the herb, is about $3 to $10 a day, depending on the size of the formula, the types of herbs, the quality of herbs, if it's organic, if it's not organic. I would try to keep it more to the 5 range, but it depends. It depends on the person. So it comes in a lot of forms. So the traditional form is what I showed you in the last slide, or this, which is a formula I prepared in the traditional way. But it comes in powders, teas, pills, capsules, decoctions, tinctures, granules, and then also external use, plasters, creams, suppositories. So they can be very effective for a wide range of issues, which would surprise most people. Moxibustion is mugwort or heat therapy. So we would burn the mugwort, which is an herb, a dried herb, on top of certain acupuncture points. Because of the situation here, without windows opening and people being sensitive, we'll probably use the smokeless. You ordered them. Okay, thank you. And also these TDP heat lamps. So I think we got those as well. So heat therapy, it would just be part of any acupuncture treatment. It's not like an extra thing. So heat therapy is actually very good for reducing pain, swelling, and just supporting our diagnosis of the body. So with the yin and yang, let's say they're yang deficient, they don't have enough fire or warmth in the body, then we might use more of that. And that happens more in the winter. Cupping became famous last year when Michael Phelps appeared winning the Olympic gold, I think it was gold, swimming with all these round bruises on his body. So that's how you might look after cupping. Not everyone goes away with such prominent round spots, but I guess he had a lot of stagnation in those muscles. Cupping, we create a vacuum, and that can be done physically with a little pump or silicone by pressing it, but I will try to use the traditional fire cupping because I feel like it disinfects better. So that's this glass cupping here on the right. The bamboo is another traditional thing. So actually a lot of people don't know that aside from pain and improving circulation and relaxation, we can also use this for things like coughs and colds. Who would have known? So there's a few other methods that I won't go into in great detail. We do body work, scraping. I think I'll use microsystems acupuncture and acupressure a bit more, because basically what that means is being able to treat someone using the ears, the scalp, the hands, and these are all kind of blueprints of the whole body. So you can use the ear to treat the whole body. And that can be very good for cancer patients, because maybe if they have prone to bleeding or whatever and you don't want to puncture their actual body, then you can try to use a microsystem. Laser as well, you don't have to puncture. So we don't have a laser here, but maybe in the future we'll get a laser. This is a picture of of people doing qigong at the hospital that I was at. So there's a nurse who was leading the patient, these at the oncology ward, was leading the patients to do some qigong breathing and movement exercises. It's not the best video because I took it myself. Okay, and then just what people can expect. So typically I like to do a pretty thorough history and assessment, as I'm sure you all understand and do as well. So if someone is new to the Marsden Center, that would be an hour and a half usually. If they're an existing patient and a lot of the information's already on file, then I could probably do it in 75 minutes. But we have like specific questions that we ask and things that we look for in traditional Chinese medicine that are pretty specific. So if they really want to do it in 60 minutes, I can, but it just might be like abbreviated and I wouldn't get to all the details that I would like to, or maybe I'd have to spread out the intake over 2 sessions or shorten their treatment. So that would include ideally an initial acupuncture treatment after the history and assessment. That would include asking a lot of questions. We're sort of infamous for asking about things like the color and shape of the person's bowel movements in great detail, the type and timing of sweat or other symptoms. And then we also look at their tongue and we take their pulse. I also like to do an abdominal palpation. So some of the people I learned from for Japanese acupuncture and classical formulas, you also press on the abdomen, and that can also tell you about the state of the person's health. For follow-ups, it would be shorter, 45 to 60 minutes. And for the frequency of treatment, it's typically recommended to do 2 or 3 a week if the person has some like intense symptoms or something they want to change quickly, unless they're just on maintenance. If they're just kind of doing general wellness, there's nothing majorly wrong, then maybe a week, once a week to start with, and then space it out maybe every other week or once a month or whatever, depending on their needs. But if they really want to shift something, then at least twice a week is better at the beginning. And then usually we would recommend an initial course of treatments of at least 6 treatments to see a shift. Well, we'd also give them homework, so personalized recommendations for things that they could eat, exercises to do, or lifestyle changes, breathing and meditation exercises as well. I will be trying to track the progress of patients in terms of their complaints once I figure out how to use Acuro. So I'll be making use of those scales and whatever to just see, oh, is their complaint decreasing over time, like the pain scales, and other questionnaires, probably the quality of life questionnaires for the cancer patients. In terms of how people can get ready for the treatments, they could fill in the forms in advance, which are pretty long, and they could, if they can wear loose clothing, it kind of helps the whole process go faster, and of course show up on time. That's about it. Okay, in terms of my own personal approach, then I like to be patient-centered. I just basically go with the person and what their own goals are. I try not to impose my judgments or goals for them. I also, because I have a pretty long history in working in community health and social service organizations, then I try to have an inclusive approach in terms of being aware of diverse clients and their needs, diversity in terms of race, gender identity, sexual orientation, et cetera, et cetera. And I also use a trauma-informed approach, which means that that I take it upon myself to understand how someone's past may be affecting their current health issues. So if someone's gone through some traumatic events as a child, whether that's abuse or some kind of severe accident or whatever, then that may still be affecting them today. I do consider a cancer diagnosis to be a form of trauma, so I kind of integrate that knowledge into how I approach the patient. Mindfulness is a type of meditation, I guess, an adaptation of a Buddhist meditation technique that's now widely used in healthcare and has been shown to be quite beneficial for cancer patients and people with pain and that kind of thing. So I do have training in, I've been meditating for a long time, and I developed a mindfulness course. So I try to bring in those approaches when I work with a patient as well, depending on their interest and willingness. Evidence informed, as I mentioned, I try not to make things up. I try to look at what's out there in the research and draw from what's been kind of shown to work. Care for caregivers, that means that, I myself was a caregiver when I was young because my mom got quite a serious illness when I was 12. So for most of my adolescence, I was caring for her as well as my younger siblings. And I know that a serious health diagnosis really affects everyone. It doesn't just affect one person. So to me, it's very important to also welcome the people around the person with the diagnosis and to give them support and understanding and a space to be honest about what's going on for them and to get some help with that. So I did start this thing several years ago called Care for Caregivers and Changemakers to kind of try to focus on that aspect of things. So yeah, I welcome the whole family. So thank you for listening to me. I hope that was not a total waste of your time. And if you have any questions, please let me know.
Is Oncology Acupuncture from your business name?
Yeah. Thank you. I made it myself. I know, I kind of barreled through. Patients and what? I actually aligned them. And actually, I give more time for the same amount. So, yeah, so what I did was I took the 75 that you might do for a half hour, and I would see the person for 45 minutes for 75. And then for...
Which